Well, first off, does everybody agree in this room that Medicare is on a fiscally unsustainable path? It will be, the Medicare trustees tell us it will be insolvent.
By 2024, if nothing changes.
If nothing changes.
Why did you vote? The question was simple. Why did you vote to privatize Medicare?
I didn't privatize Medicare. I'll tell you what you vote for.
Why did you vote for the Ryan plan?
Let me tell you what.
It cost me $6,000 more
Let
per
me
year
answer your question.
than somebody 10 years older than me.
Let me answer your question. First, we have to put the country on a fiscally sustainable path. Medicare must be protected and preserved for this generation. And I have an 82-year-old widowed mother. And I want to make sure that anybody over 55 is going to be able to keep the program as it is, as it was promised to them. As it was promised to them. It should be promised. Now, for those people who are under 55, the system is going to change. Look, insolvency, if we do nothing, we just let this go, with the health care law and all the other things passed, you're talking about a 17% immediate.
You're not answering the question.
I am answering the
No,
question.
you are not. You're not answering the question. Why did you vote for the Ryan plan, which would take Medicare and convert it to something that the private insurance companies manage?
It would, under the plan, it would actually make Medicare for people under 55 turn into a program very similar to what federal employees and members of Congress are eligible for.
Would it control costs? Would it control costs?
But we'll be happy to get to cost control. I'll tell you what, we're not doing a very good job controlling costs right now.
But the Affordable Care for Obama will do that.
This alliance for.
Yes, that's supposed to do it. It's gonna, yeah. Gets rid of the advantage plans.
Supporting your current effort on the iPad.
Sorry.
They recommended that I look at this
Sorry.
the Kaiser Foundation report, which I did. And it's cited in there, it's footnoted that from 2001, 1970 to 2009, the average increase for
You see, that's in the,
private Medicare was 8.3%.
that's a,
Pretty close to the average increase.
I never heard of that.
Let's talk about Medicare.
9.3. More, increase in private insurance more than Medicare.
That's right.
Over at 1970 to 2009.
Private insurance is a profit taking company.
So let's talk about, let's just talk about Medicare for a second. Let's talk about it. I mean, 10,000 people every day are now going on Medicare. We've all known that the baby boomers were going to retire. The day has arrived. 10,000 per day. That'll be 15,000 over this decade. Maybe some don't want to believe this, but Medicare is going to go insolvent, according to the Medicare trustees. They're telling us this. I mean, this is not. I wish the facts were different, but that's reality. I mean, we have to have an honest discussion.
Wait a minute. You can't do that kind of thing.
Well, let's back up. Well, the health care law that was just passed, it raided Medicare. It took $550 billion out of Medicare, not to shore up Medicare or fix Medicare, but to create a new entitlement program, a new health care program for people who are not yet 65.
That's
And they
flat
did
out
that.
false.
No, it's not false.
It's
And they expanded Medicaid in the process to 133% of
Flat out false
poverty.
if you're
That's why so many of your
$500
governors are suing the federal government right now. But let me finish on this. The Medicaid issue. You cut Medicare. They cut Medicare, but they cut Medicare, expanded Medicaid. Now, look, how many private physicians out there right now take Medicaid patients? Not a whole lot. Not a whole lot. And so people, they have coverage through Medicaid, but they don't have access to care. I don't want to see Medicare reimbursements, and you mentioned the IPAD, the Independent Payment Advisory Board, that is going to be 15 bureaucrats who are going to make decisions in terms of controlling costs of Medicare. The way they're going to do that is just ratchet down payments to providers. Medicare pays less than 80
People
cents an
go
hour
without
now.
care health insurance, they go to Lehigh Valley Emergency Center, they sit there to get treated, or they go to St. Louis, get treated. Guys like me come in, and we have to pay it out of our taxes.
That's correct. Out of your premiums.
It's a no-win.
Well, look, you're talking legitimately about a cost shift. That's a cost shift. And we all understand that cost shift. If somebody shows up in the hospital without coverage or underinsured,
You gotta pay for it.
it's shifted to all of us.
That's right.
Okay, we all get that. Don't believe it. We get it.
System that works. The only thing that we need to do is tweak it and try and finance it. And right now, we're more interested in financing oil companies and everything else under the sun and letting the middle class, fend for themselves. I think there should be some shared sacrifice. I think GE ought to pay taxes. I pay taxes.
Yeah,
My wife
GE
and I paid over the years of 80 years worth of taxes. By the time we retire, we're gonna have close to that or more. So I feel that this was our promise, okay? We planned all these years to retire, and that was part of our retirement plan, that there was gonna be Medicare. Now all of a sudden, we're gonna get a voucher. I think privatizing Medicare is a wrong way to go, and I'm very disappointed in the vote for the Ryan budget, because I think there is no shared sacrifice in that. They're saying, and the debt ceiling, they're talking about now they're gonna put the country into a credit tailspin by playing this game of chicken, where they're gonna see who blinks first. Well, you know what? They're gonna raise our debt, if they raise our debt limit, if they don't raise our debt limit in a proper manner, they're gonna drive up our interest rates, they're gonna lower our bond ratings, and you know what? They had guys on TV the other day, guys like Paul Volcker and people that were on before, that were on the show before, Bernanke, Bernanke's on right now, I guess Alan Greenspan was on, and he just shook his head in bewilderment during these hearings and said, we can't do this. We cannot do this because all of our pension funds are tied into Wall Street. We're having problems funding pensions now. Harrisburg's having trouble funding pensions. Private companies are, and now we're gonna play this game of chicken, and if we see that the stock market sees this, they're gonna go into a tailspin. Then we're gonna see problems with pension funds. You're gonna see real problems. This cannot happen.
Well, on the debt ceiling, look, the debt ceiling is going to be addressed, and the issue is, what terms and conditions are going to be tied to the debt ceiling increase. I don't think there are many people in Washington, or around the country for that matter, who just want a simple, straight-up debt ceiling vote. They want us to deal with what's driving the debt. And you also mentioned Medicare. Look, today, as I mentioned earlier, there are a lot of folks, a lot of people out there who provide services to our seniors, healthcare services, who are limiting what they take in Medicare. Medicare is a good program, but it is on an unsustainable fiscal path. That's a fact. It's a fact. I mean, I wish it were different. I wish it were different, but that is the reality. But there's something I want to mention too about this on Medicare. I talked to you about the demographic problem. The 10,000 a day are going on Medicare, 15 million over the next decade. Costs are skyrocketing. When you look at Medicare too, if you look at a couple that's turning 65 right now, and they paid in $109,000 into Medicare, that'll be over a lifetime. They're going to receive probably about $343,000 in benefits. Okay, that's today. I mean, I wish the facts were different.
Look at
But-
GE's
well, the
pride.
point is, well, if you pay,
What do they pay?
well, the point is,
Interest on it anyway.
well, the issue is, well, somebody's announced earlier that, suggested earlier that we just expand Medicare to everybody. Well, I said it's going broke for the people over, it's going broke for the population currently served. So how do we shore it up for those who are retired or near retired?
Make
making
the
sure that
corporations and the oil companies pay their fair share. GE paid nothing last
Okay,
year.
let's go back to this.
I'll show you my tax bill. I paid Charlie.
The president stood up the other day, flies on Air Force One, and said if we just raised taxes on corporate jets and the oil company manufacturing deduction, that would somehow fix Medicare. Well, that's not going to fix it. It's not going to be, he implied it. He implied it. I heard the speech. I heard the speech. Somehow that was going to fix it. That was going to put us on a path to Senate funds. I heard the speech very carefully, and I also heard the comment too about, that his daughters do better work than he did. I heard that as well. That was.
Maybe it's true.
Then you missed the point.
Yeah, my kids show up in school. I wish the president had been part of these discussions sooner. He just showed up. He was AWOL from the discussion. No plan. No plan. He said no plan. I really wish he had. I mean, I wish he'd been more engaged in
What
a lot
about
of
the
these
discussion that
discussions.
his Vice President Biden was in with, you know, the 3 and 3 and then Cantor leaves? I'm going home because I'm not talking about taxes.
Well, now, I hope the president's engaged now, I really do. I hope
So
he's
having
engaged.
Biden there is like having nobody at all.
So wait, let me,
Hey, what about when he did have a plan and when he mentioned taxes, who runs out of there?
well, I mean, if, people were talking about taxes, again, I don't think raising income taxes at a time
That's
like this is
beside
gonna
the
help this
point.
economy. It's
That's
not
beside
gonna
the
help.
point.
It'll
On the
help.
wealthy.
It'll help with revenues. If you ask wealthy people to help the economy, it's gonna help. If you just say, give
help create jobs.
3%, no, certainly it will.
Cutting
Certainly
taxes
will.
under Bush saved,
Right, we're trying to get back to fiscal sanity. So ask everybody for a share of sacrifice. We're willing to give our share. We just don't want to see you guys, the Republican Congress say, but tax subsidies for the oil companies are off the table. But tax cuts for the wealthy are off the table. Now, if you want to saddle us with some skin in the game, put some of their skin in the game. Come on, man.
Well, you're the chairman of the Democratic Party.
I am. I'm a citizen.